Causes of lower back pain can range from joint inflammation, muscle damage, arthritic changes, bulging disc or herniated disc. Everyone's heard the term bulging and herniated disc, but really what is that and how does that cause pain in the back? Well, let's talk about the disc itself. The disc itself is a soft tissue structure that sits in between each vertebrae. The job of that disc is to allow for movement and support. The disc itself is made up of two different materials. It has thick outer bands around the outside like elastic and gel that's in the middle. The most common analogy is a jelly donut. Well, the purpose of the outside bands are to allow for that movement back and forth. The gel that's in the middle is to help with shock absorption. If there is an injury to the outside bands and it doesn't hold the shape that it's supposed to, then you have a disc that starts to bulge. If there is a tear and the gel that's in the middle has made its way out, that is a herniation. So the terms bulging disc and herniated disc are more descriptive words. They tell us how much damage there actually is to a disc. Now, how that relates to pain. To give you a frame of reference, when you touch your back and you feel a bone, that's the part of the spine that you're feeling right there. So here's the back, this is the front. Right at the back of the disc, you have a hole. That hole is where the nerve comes out, and in the case of your lower back, goes into your leg. On the model, this is just an open hole where the nerve is flopping around, but in real life, it's not like that. There's other stuff in there. There's insulation, there's packaging, there's fat, there's veins, there's arteries, there's other stuff in there, but everything has its own place. If you take something that isn't supposed to be there and stick it into that area, it now compresses all of that packaging and insulation, which can either directly or indirectly compress on the nerve. When there's irritation to the nerve, anything or any place that that nerve travels or controls will then start to hurt, tingle, vibrate, spasm, feel weak. Every nerve that comes out of your spine controls three things: skin sensation, reflexes, and muscle strength. When a nerve is being irritated, it doesn't necessarily mean you're going to have lightning shooting pain going down an arm or down a leg. It could mean that any one of those three things or any combination of those three things that a nerve controls will have a problem. How we treat a disc bulge or a disc herniation is to get as much pressure and stress away from it so that it can start moving and acting like it should again. Manipulation of the joint. When the disc is flared up, or if there's an injury to the disc, the body's natural response is to tighten the area up to protect it. If you tighten that area up and protect it, the vertebrae does not move. That does not allow for the proper healing or for there to be stress taken away from the disc. So what we want to do is get this joint mobile and moving again so that the disc itself has the freedom to move the way it wants to. That's done through joint or chiropractic manipulation. The next part would be to decompress the disc. When you have pain in your back, or if you have a disc bulge or a herniation, you sometimes might feel like if someone just pulled you apart, it would feel better. Or if you lean up over something and drop your legs and let your back stretch, it feels like all this pressure is taken off. Well, that's your body instinctively telling you what needs to be done. Spinal decompression, traction, something to pull that area apart, to take pressure off that disc, to give it a little room to breathe, take some pressure off of it. If you take pressure and irritation away from the disc, you are then starting to draw pressure and irritation away from the nerve. You take pressure and irritation away from the nerve, you start taking care of the symptoms that first brought you in. We're going to take a look and work on the root cause of your symptoms, not just something to cover it up to help you get through your day. The disc itself is a very tough, strong structure. If you have damage to the disc, then you have damage to all the other soft tissue that surrounds that disc. You can damage muscles, tendons, and ligaments easier than you can a disc. So, If you have disc damage, it is assumed that all the other structures around it have damage to them as well. Not only are we going to approach the disc injury by taking pressure off of it and making sure that the vertebrae is mobile and moving the way it needs to allow that disc to do what it's supposed to, but we're also going to focus on strengthening the damaged or deconditioned muscles around the vertebrae so that it now holds and supports that the way it should and move it the way it should, which takes irritation away from the joint, takes irritation away from the disc, that takes irritation away from the nerve. Irritation away from the nerve helps with your symptoms. If you have pain in your back and any symptoms going down your leg and an MRI is done and it's found that you do not have a disc herniation and you wonder why I still have pain in my back or pain still going down my leg, if the disc has been ruled out, then the next structure is the joint, right behind the nerve. If you sprain, injure, or damage the joint, it causes inflammation. Just like if you sprain your ankle, it swells up. If you sprain the joint, there is swelling around that area, and because of it being right next to the nerve, will cause irritation to that nerve, which will mimic the same symptoms that you would get if you had a disc bulge or a disc herniation. The treatment for that is somewhat the same of what you would do for a herniated disc. Spinal manipulation. Get that joint mobile, get it loose, get it lined up and moving the way it should. That right there takes irritation and stress away from the joint. Strengthen all the structural supporting muscles around it so that it holds that vertebrae and joint in place and moves it the way it should, which will take irritation away from the joint, which takes irritation away from the nerve, which will help you with the symptoms that you have in your back or into your lower extremities. Our goal is to figure out what is wrong with you, and if it is something that we can treat, devise a treatment plan specific to you to get your problem taken care of and get us out of your life as quickly as possible. I'm Dr. Stuart McCranels. Call us at Injury Treatment Solutions.